Table from SCHWARTZ. Okay, so symptom and signs of neuropathic ulcer versus ischemic ulcer, important table for examination. Okay, so we'll see the difference in neuropathic ulcer and ischemic ulcer. Okay, so in neuropathic you have to remember all the problem related to nerve, and ischemic all the problem related to blood supply. Okay, so in neuropathic the pain will be, there is no nerve, good nerve intact, so it will be painless. Okay, okay. In ischemic ulcer there is a ischemia, so ischemia will cause pain. Okay, and nerve is intact. Okay, so it is ischemic ulcer is painful, neuropathic ulcer is painless. Okay, so now comes the pulse. So in ischemic the blood vessel is not good, so there will be no pulse. But in neuropathic ulcer the blood vessels is there, so pulse will be normal. Okay, okay. Now come to the appearance. Okay, so in neuropathic ulcer the blood supply is good, so the all around the wound there is a healthy tissues. Okay, so it will be form a regular margin. Okay, and there will be, because of this regular margin, it will looks like punch out appearance. Okay, in ischemic ulcer it is irregular margin. Okay, because the surrounding area is also at risk. Okay, so it's irregular margin. Okay, now come to the location. So neuropathic ulcer located on the high pressure area where the most of the body weight is there, so it's on plantar surface of the foot. Okay, because of nerve compression. In ischemic ulcer it will be located on the farthest point of the body. Okay, the farthest point, so it is most vulnerable to get least blood supply. So toes and glabrous margin. Okay, okay, the toes is important. Okay, now come to callus. So callus is a sign of healing. So since the blood supply of neuropathic ulcer is good, so there will be callus, but in ischemic ulcer there will be callus is absent. Okay, okay. Now come to reflexes and sensation. So in neuropathic ulcer there is no nerve, so it will be loss of sensation and reflex and vibration. So and in ischemic ulcer it is variable sensory finding, so it's variable. So remember neuropathic ulcer, loss of sensation, reflexes and vibration. Okay, okay. Now come to the blood supply. So in ischemic ulcer there will be decreased blood supply. In neuropathic ulcer it is increased blood flow. So increased blood flow also you can say it's AV shunting. Okay, arteriovenous shunting, because of arteriovenous shunting. Okay, okay. Now come to the veins. So veins here in ischemic ulcer all the vessels like collapse, so veins are collapsed. Okay, in neuropathic it is dilated. Okay, okay. Now the temperature. So in there is no blood supply in ischemic ulcer, so it will be cold, and in neuropathic ulcer it is warm, and the dry. Okay, the remember the dry. Okay, dry. Okay, now come to the bony deformity. Since there is a not nerve good supply and the muscle and reflex is also not working, so high chance of bony deformity in neuropathic ulcer. Okay, so but in ischemic ulcer that bone is intact. Okay, and then appearance. Since the blood supply is good and even high in neuropathic ulcer, so it will be red and hyperemic. Okay, in ischemic ulcer since blood supply is less, so it will look like pale and cyanotic. Okay, so remember, so important table, difference between neuropathic ulcer and ischemic ulcer. Okay, thank you.